Hi, so greetings from Poland, and yes, today I will have a pleasure to outline the Poland's footprint on the European Union level regarding HTA. Please, next slide. This is the picture of our involvement in this process. We are a designated member of the coordination group. What you see here, that we are very active because we are participants of all subgroups of coordination group. So the scope of the range of our work is pretty broad, because it covers medical products and medical devices, and AOTMiT is a part of the consortium which won the single framework contract for JCA and JSC, and this ensure financial resources to build capacity for the next years. Please, the next slide. And this is our ongoing engagement. In 2025, we were involved in 9 PICOs, and we are also co-assessors of ATMP product, working together with our French friends. And we also actively participate in joint scientific consultation subgroup tasks. Please, the next slide. It is very important. It was very important to predict the situation and to incorporate JCA on the national level. Is because it's a factor that gives the continuity of our activities. So as you see on the slide, in 2025 there was amendment to the Reimbursement Act, and it covers like 3 main features. And first is first outcome is that there is no need for a national clinical analysis when European Union when evidences are available for the same indication and target population. What is also in this act, that the situation when the clinical analysis is still required, and it's when there is no full alignment with the European Union assessment, or if a joint clinical assessment is missing. There is also a change for HTDs to give a supplement to European Union report with additional data when relevant. Please, the next slide. This process has its risks and some challenges. So the most important limitation from our point of view is the poor quality of evidence available at this stage of the life cycle of the medical products. EAA allows for registration of products on the very early stage of clinical trials. So for the registration, evidence is it is only need to prove its efficacy and safety, but HTA is a comparative analysis, and it requires a broader set of data. For ATH, data must be mature enough for extrapolation of long-term outcomes and to enable comparisons. So that is an important limitation. Another thing is poor quality of the HTD reports, and it's because of these short timelines mentioned before. Any changes in PICO result in the need of changes in the documentation of the HTDs. This lack of flexibility in deadlines is also difficult for us, because only EMEA decides to change the timeline, and these decisions are made case by case. So there is no like official way of the changing of timelines. And the last but most frustrated one factor is that if the registration is not achieved, all invested resources and work will fail to deliver the expected outcomes. So it's difficult to say, but let's say this work is wasted. So please, the next slide. Here you see this the stakeholder engagement in PICO. For us, it's crucial to balance this engagement and confidentiality. First of all, about clinical expert, it's very very valuable to have this impact, but there are some problems because there is insufficient number of clinicals willing to collaborate with us, because of course all of them have to sign the conflict of interest declaration. So yes, and we also sign confidentiality agreement. We collaborate with HTDs. They can submit their input anytime via the dedicated mailbox. We also had 2 face-to-face meetings, so they could present their perspective for PICOs. But of course, we don't share any information. So we listen, we take this into consideration, but of course, we don't share because of the confidentiality. And at this moment, there is no local patient involvement. However, our agency, in collaboration with EDCAPRA, has launched a new initiative. We call it Capricord. So we start with pilot patient consultation to inform them about their possibilities to be involved in PICO development. Please, the next slide. Oh, this is us. Can you change the slide, please? So what are the next steps? The agency is facing an increasing number of tasks related to European Union HTA, which is why we are planning to expand the team, and it is probably in all agencies that there are many new activities. So finally, successfully, we are authorized to hire 10 additional analysts, and in November this year, we established a dedicated division focusing only on JCA and JSC, and we hope that this new structure will help us coordinate these processes more efficiently and strengthens our analytical capacity, because it's number of people is one thing, and another is to build a huge capacity and capacity base. That's why we're gonna take part in HTR capacity building program. And nowadays we launched a new project. So we started working on national HTA guidelines to update national guidelines update to have them more in line with the reality of JCA. Please, the next slide. And this is probably the last slide. So I would like to share some positive information. We really support European Union HTA, and we see it as a strategic investment in the future of the HTA. JCA is expected to harmonize HTA practices across the member states and fostering greater consistency and efficiency. Examples from JCA processes show that drugs are often approved too early, and this process allows us to bring the perspective of EMIs and HTA closer together. At national level, JCA might support locally submitted dossiers, potentially replacing clinical analysis and then accelerating the reimbursement process. And this is also attractive for HDDs because they can. This process decreases the costs of local procedures. But what is crucial, a lot will depend on when the producers submit their applications in Poland, and on whether the analysis prepared at the European Union level will be sufficient at that time, or if they will need to be updated at the national level. Next slide. There are some question marks about this process because we are at the very beginning, but we are pretty enthusiastic, and that's why we are very active both in scoping and in the assessment. Thank you.
Thank you very much, Anna. Would you please stay with us if we have questions at the end of this session?